I'm Michelle Fideli from First 5 Marin Children and Families Commission, and this is our monthly policy gathering called the Marin Communications Forum. Glad you were able to join us today. We have a very important issue to discuss, and that is the health impacts of cannabis. Certainly a big issue in the paper today, yesterday, and tomorrow. Everything is changing, and there's definitely a lot to learn. I think we all know someone who has used cannabis recreationally for a lot of years without incident, and a lot of us may know someone who's been using cannabis, medicinal marijuana, successfully to treat nausea or pain or something else. But there are plenty of stories of things that have gone wrong and things that are changing and new information. And that's what we're here today, is just to learn about that and learn the latest information on what we know about the health impacts. But because everything's changing, we wanted to start off with just information about the law, about state law, local ordinances, and federal enforcement, just to figure out where we're at and what's coming down the pike. So to do that, we're going to begin with Inga Lundegaard from the Community Development Agency. Sorry. Oh, I'm sorry. Dr. Matt Willis is going to begin first. Thank you. With a little background in terminology, and then we'll get into the legal situation. Thank you.
Good morning, everyone. I'm Matt Willis, Public Health Officer for Marin. And I want to start by sort of offering, the perspective of the Public Health Officer is our role as Health and Human Services is to promote, protect the safety, health, well-being, and security of all people in Marin County. Medical marijuana and recreational marijuana, cannabis, is a topic that we have not yet really engaged at the community level in terms of the health implications specifically. There has been a lot of conversation about policy and regulations. Ideally, those conversations would be rooted in an understanding of the health implications and what we know about the evidence of potential harm or benefit. So our goal today is to offer you all the knowledge you need to be able to be active participants in the conversations that are coming around policy. When I talk about medical cannabis or recreational cannabis with friends, the first question is, are you for it or against it? Yes or no? Good or bad? And I want to start by saying neither, or both, right? When I was in medical school, I had a professor that said, science is always changing, evidence is always changing, we're always learning. Half of what you're learning is going to turn out to be wrong. The problem is we don't yet know which half that is, right? So part of what we're trying to do is understand truth from fiction here. And I hope that over the course of the next couple hours, we'll be able to tease out some of what we can really hang our hat on in terms of the true evidence around health risks, especially with regards to young people. And just as a sign of the timeliness of this conversation, this was today's newspaper, today's IJ. Various cities in no rush to enable the pot trade. And this is the Novato mayor who said, we need to discuss it more in depth with more input from the community regarding what they want and what they don't want. It's a perfect organizer for this conversation. So we are the community, you are the community. Policymakers are looking for input from the community, and we're trying to provide you with that information you need to be informed. So congratulations. You are on an honor you may not even be aware that you've earned, which is as participants in Marin County, you are among the, contributing to the objectively healthiest county in the United States by some measures. This was a study that was published by U.S. News and World Report. It's sort of like the college rankings. Healthiest places to raise kids, Marin County was ranked number 1. Importantly, what is not included among the index, the metrics that they're looking at are those related to substance use. And if we look at substance use, so here's another area where we excel. Marin County has been ranked the healthiest county in the state of California, 7 out of 8 years. And we're looked, 30 different indicators of health across the community. I'm not going to go through all of these, but these are basically those that we are ranking in the top half relative to other counties, which is almost all of them, except those related to substance use. So these 3 are also included in the county health rankings: excessive drinking rates for adults, drug poisoning mortality rate, and alcohol-impaired driving rate. And then the other one at the bottom there, income inequality, which we are actually one of the least equitable counties in terms of income across the state, if not the nation. But I know First Five's talked about that. That's another important public health priority for us, but that's a different topic. But the point is that someone is trying to tell us something, right? When it comes to substance use, Marin County has a unique problem. So when these rankings come out, the U.S. News and World Report, the Robert Wood Johnson County Health Rankings, I often get, they're annual, and I often get a call from media saying, what are you doing right? Right? What's your secret sauce in Marin County? What makes you the healthiest county? So I pose that to you. What is it about Marin County that makes us the healthiest county? And I would suggest, if affluence is, we know we're also the most affluent county. We're also the county with the highest proportion of people with higher levels of education. But if that's our story for the nation, just, more education and more wealth, I'm not sure we're really offering what the nation needs from us in terms of lessons in being healthy, right? I think what we're about, one of the things I like to think contributes to our health as a county is the fact that we have conversations like this one today, right? Is that we're actually honest and truthful, and we're able to ask the hard questions and actually really have the dialogue we need to remove barriers to health across the community, even if they're hard questions. And I know the marijuana conversation has been challenging and politically intense, but it's a conversation we need to be having. So place matters. This is regional variation in cannabis use. So the place in the nation where there's the highest amount of cannabis use is in Northern California. And I share this with you because, and we'll get more into the numbers later, to sort of ask the question of how do we know what normal is when it comes to health behaviors, right? Let's take another example, obesity rates. Right, cardiovascular disease. There are places in the southeast, where about 90% of the adults are obese, right? Where the total caloric input is about 3 times per day what it is in a place like Marin County, right? So fast food consumption is almost every day. Big gulps are normal, right? That's normal for those communities, right? Life expectancy is much shorter in those communities because people are dying prematurely of stroke and heart attack, diabetes. You go into a community like that and you talk about healthy diet, it's a very different conversation, right? Because what's normal there is different than what's normal here. So when we look at Marin County's rankings and we see that we have a problem with substance use, it's an invitation to rethink what's normal. So there's regional variation in cannabis use, there's regional variation in alcohol use. Only 2% of counties have higher rates of alcohol consumption for women in the entire nation, right? So, and the others are like northern Wisconsin, Native American tribe, places where it's sort of known to be an issue. And then regional variation in opioid use. So the point is that when it comes to any sort of health issue, place matters, and what is considered to be normal is derived from what explains why differences, right, in rates of substance use between communities. It's norms and culture, policies and practices, knowledge, attitude and beliefs, demographics. And when those norms are unhealthy, how do they change, right? And so they change by understanding the science and through conversations like the one we're going to be having today. So that's just some background framing. So this is cannabis. Cannabis, for the purposes of this conversation, we jump between marijuana and cannabis. The vocabulary seems to be moving more towards cannabis. When we talk about medical marijuana, that's a term that is preserved, like the medical marijuana ID card. But otherwise, we're trying to use the term cannabis. And cannabis denotes the several psychoactive preparations derived from the cannabis plant. There are 3 subspecies of cannabis: sativa, indica, and ruderalis. And cannabinoids are the compounds that modulate neurotransmitter release in the brain. So cognition, memory, emotion, sense of time, coordination. So what does it mean to be high, right? These are the ways that these are. Being high, in quotes, is changes in cognition, memory, emotion, sense of time. So the specific effect of cannabinoids is to change neurotransmitters in the brain and it leads to that experience. THC is a primary psychoactive component, and cannabidiol is a secondary compound, which is less psychoactive, but is associated with some of the medical benefits. We're still learning a lot about cannabis. From 2005 to 2015, the number of cannabinoids identified in the plant increased from 70 to 104. So this is a plant, right? So it has a lot of different things in it, and depending on where the plant, there's regional variation, and we're still actually defining all the different elements within the plant. So one of the ways in which medical marijuana differs from other forms of medicine is that we don't even actually know sometimes what is causing the effect. If someone is having therapeutic benefit or seeming to have therapeutic benefit or harm, which of those 104 compounds is contributing to that specific effect? And one of the reasons we don't know that is because it is a Schedule I DEA drug, right? So it's actually, we're not able to do the kinds of studies, the randomized placebo-controlled clinical trials we might do with other forms of medicine. So some of the other terminology: cannabis, marijuana, weed, pot, reefer, Mary Jane, bud, grass, ganja, sinsemilla, the list goes on. There are concentrates of this: shatter, butane, hash, oil and wax, earwax, and dabs. These are the oil concentrates where the concentration of THC gets much higher. And we'll later in the presentation have a fun quiz where you can try and figure out whether or not you can recognize the marijuana compound among things that have the oils in them. Butter, edibles and medibles, salves, lotions, and tinctures, so it can actually be applied on your skin and be absorbed across the skin. Marinol, which is actually an FDA-approved compound of one of the cannabinoids, dronabinol. And then there's synthetics, which we're not going to talk about today, but there are actually synthetic cannabinoids that are also available out there. And then hemp, which is the plant itself, which can be used for its physical properties like fabrics. So it was first cultivated in the Himalayan region around 6,000 years ago. They have ancient, burial sites where they see ritual use of cannabis. It was associated with the Hindu god Shiva, smoked, ingested, and also used for fuel, cloth, and rope. Imported to the United States around mid-1800s and was listed in the United States Pharmacopoeia and National Formulary until the 1930s, and was sold as a remedy for over 100 ailments. Not well studied at the time, but purported to actually help with over 100 different ailments, and was actually available from such establishments as Sears, Roebuck, and Company. So there's different ways of administering cannabis. You can ingest it into your lungs. So very rapid mechanism of getting it into your bloodstream is actually getting it straight into your mucosa of your lungs. So smoked or vaped, onset effect is seconds to minutes. Within seconds of inhaling cannabis, you can actually see levels of THC rise within the blood. Peak concentration is about 20 minutes with variable bioavailability up to 56%. And it lasts for about three or 4 hours. There's consuming it orally, eating it. These are the edibles. Onset of effect is up to 1 hour after ingestion, and it's about an hour to 2 hours to the peak concentration. Bioavailability is a little bit lower than some of the high bioavailable inhaled forms. Bioavailability is the way in which a certain concentration of THC. Who asked that question? Oh, hey Don. Yeah, the certain amount of the amount of THC in the product itself, and how much of that actually gets into your bloodstream. So bioavailability in the lungs can be much higher because you're actually getting it right first pass straight in, whereas in the stomach acids and other things interfere with actually accessing the THC that may be in the compound. So you can have very high concentration THC edibles, and not all of that passes into your system because of lower bioavailability, if that makes sense. And then there's oral mucosal and sublingual forms, like some of the oils. Peak concentration to 30 minutes. And what's important about this is that the oral agents, because they take so long to actually take effect, people may not realize and consume more, waiting for the development of symptoms. I'm not feeling any different, I'll take more. I'm not feeling any different, I'll take more. Not realizing that it's going to be an hour before the symptoms begin in the first place, and by then they have ingested a dose that will lead to an overdose. So another important point, just to sort of guide our general understanding, is that THC levels have steadily increased in the past 30 years. So because a lot of us because of the lack of evidence, I think there's a lot of anecdotal experience being brought to this conversation that I've been a part of, even at the Board of Supervisors. People are developing their conclusions about this based on their own experiences from their own past and from their friends. The problem with that, there's lots of problems with that, but one of them is that the adults who are making these conversations are basing their decisions on a history of marijuana that is no longer the current status, right? When I was in high school, it was about 10 times less strong than it is now, right? So when we talk about kids now ingesting marijuana, it's much stronger, and the risk of overdose is much higher. THC potency has increased globally. The World Health Organization says the THC concentration across the globe has increased over time because they're actually cultivating the plants to be stronger and stronger. Medical grade cannabis is up to 35%. Historically, we're talking about 2 to 3% THC in the 1980s and 1990s. And then some of the concentrates, the oils, where you're actually distilling the oil out, ranges from 40 to 80%. And some of the compounds are almost 100% THC if the oil gets that concentrated. What is shatter?
Same thing as when they break it and crack it.
It's a straightening curve.
Yeah. Okay, so it's an oil. A lot of these are sort of the terminology, different words for the same thing. And this is earwax, wax, honey oil, shatter. What is it?
They're not really smoking here.
They're not really smoking earwax. It's not actual earwax. Yeah, but they call it. So that's a background around the importance for having this conversation here in Marin County, the fact that we're dealing with a substance that is constantly evolving, and that the science is still also evolving, that the policy conversations need to be informed by some of that understanding. I'm going to offer you, after we speak about some of the local policies and understand sort of the landscape of where we are at the state and the local level with the ordinances, get into the World Health Organization and National Academy of Sciences conclusions regarding health benefits and impacts. So next I'd like to introduce Inge Lindegard, who works for the Community Development Agency, and Inge will talk about where we are at the state and local level with regards to policy and regulations. Thank you.
Good morning. How's everybody doing? Well, I'm glad I was second because now I'm awake. The coffee has kicked in. So first, I wanted to thank you for inviting me to speak. As a regulator, and I'll talk a little bit about what I'm doing, but as a regulator, it's so important to have those open conversations, those dialogues, because the challenge that we have is being able to write regulations that are supporting all groups across our community. So thank you to First Five, and thank you also to Health and Human Services, who's been a wonderful team and really supportive and of that open conversation to make sure we get the best regulation in the unincorporated Marin. So I'll emphasize that again. So I am a planner with the Community Development Agency that basically provides the regulation for this program in unincorporated area Marin. So I cannot speak for the cities. I will help if you have some questions of kind of who to talk to or what their current status is. If I have that knowledge, it is moving very quickly. And I come from a background of urban and regional planning. So as a planner, our community development agency was assigned to implement this program. And so I'll kind of walk through that portion of what the unincorporated Marin is doing after I kind of go from the top down of what's been happening. I have to learn how to make this thing work. Okay, the little arrow, that works. So what you've seen is marijuana/cannabis in the United States. So in 2017, you can see a majority of the United States has some form, so either recreational and medicinal, or limited medicinal with different regulations. So each state has created their own regulations, legislation and regulations, each county, each city within that. So you can see also how the industry has been is very challenging in order to have across the country with different types of regulations and requirements related to adult use and the medicinal side of it. So let's talk a little bit about California first. So the state in 1996, that was that original Prop 215, commonly known as the Compassionate Use Act. So that was basically the start of California to say, look, we know that there are those that are ill, that they have found, or people that started that Prop 215 found that those that were ill were supported by using cannabis for medicinal purposes. And that really grew into the 2003 marijuana program, the SB 420. That was in order, because the Prop 215 was a very vague and it was hard to implement and regulate, the SB 420 just gave some different regulations and guidance, and also created the identification card program as we know it today. In 2015, that's where you see the state took a lead and created the Medical Cannabis Regulation and Safety Act. So there was multiple Assembly bills and Senate bills. And then in 2016, you had the voter initiative, the Prop 64. That was the Adult Use of Marijuana Act. So both of those, if you hear me using acronyms, so MRSA for the Medical Cannabis Regulation and Safety Act, and AMA for the Adult Use of Marijuana Act. I might throw those out a little bit. But what happened is, with the passing of the Adult Use of Marijuana Act, is that the state said, okay, we have two different legislations that weren't always consistent. And what they did is they put it together, the medicinal and the adult use, and the Medicinal and Adult Use Cannabis Regulation and Safety Act. So, and I will reference that as MAUCRSA. So I will use MAUCRSA a lot. So that is where we are today. That was actually released and approved in June of this year. So a lot of what I've been doing for the last year is really learning about this industry, understanding, but also chasing the legislation. And literally, because the state, in essence, repealed the Medical Cannabis Regulation and Safety Act and altered the adult use, the regulations that the different bureaus put out, those came out literally last week. So I'll talk more in depth on that. So as of right now, the state of California has a legislation of the Medicinal and Adult Use Cannabis and Regulation and Safety Act, MAUCRSA. So we'll talk about kind of the Adult Use of Marijuana Act. And I'm going to jump into that just to talk a little bit about how, because a lot of people are asking, well, what happens January 1st, 2018? What does this mean? So effective in November, it legalized the personal use and cultivation of marijuana for adults 21 years of age or older. So that means that any adult over 21 can cultivate. There are regulations of how many you can cultivate, where you can cultivate. Also, Local jurisdictions can prohibit outdoor cultivation, but in essence, when it comes down to it, you can have allowed to possess and to cultivate a certain amount of marijuana. It also reduced some of the criminal penalties for specific related offenses. It includes provisions and regulations for licensing and taxation, and that's what the state kind of brought those items into the MAUCRSA. And it allowed retail sales taxation of recreational adult use beginning January 2nd. So what is unique about the legislation at the state level, it's a dual licensing. So when I say dual licensing, that means that in order to operate, if I was a business operator, that I would need a local, and I'm going to say authorization, because different local jurisdiction, a city or a county might call it a permit or a license or some sort of authorization. You would need to require that for your business, and then you need to apply to the state and get a state license. So the local jurisdictions have a lot of capability to regulate, and that's where you're seeing a lot of the cities and counties across California with different emergency ordinances to kind of say, okay, we prohibit everything, because they're really trying to understand what does their community want to do. So they're then coming back to the community saying, okay, do we want to regulate this? What business types do we want to regulate, and how do we do it? What is appropriate? Because what's appropriate in Marin is going to be very different in, let's say, LA, or San Francisco. So you have those different requirements of figuring out if and then how. So the MAUCRSA, I'll get into that a little bit deeper, but basically it consolidated, and you'll hear me say medicinal. So that's the new terminology that they're doing. So it's a medicinal purposes versus medical in the broad scheme of medical. So medicinal and adult use regulations into a single legislation. It established that comprehensive regulatory framework. And so that's where I was literally talking about some of the regulations for the different licensing agencies, and I'll go through that in more depth, have literally come out last Thursday. So a regulatory structure that prevents access to minors, protects public safety, public health, environment, and maintains local control. So those were key elements that you saw both in the original MRSA and the AMA into MAUCRSA. I have the whole alphabet here if you want it. So basically just think of it as bringing the medicinal and the adult together in partnership now in MAUCRSA. So now the question is, who's going to regulate? Or who is doing the regulation? So I want to talk about kind of the key three players. So when I say these are the Bureau of Cannabis Control, and I think this is their 5th or 6th name, but it is now known as the Bureau of Cannabis Control. That is a new bureau that was created in order to be the lead agency. And I'll get into details of like what each one of these are doing, but you have 3 lead agencies. These are the 3 agencies that are actually licensing at the state level. So you have Bureau of Cannabis Control, you have the California Department of Public Health, and you also have the California Department of Food and Ag. You can kind of guess probably Food and Ag is probably doing the cultivation, and the Department of Public Health is doing the manufacturing, making sure that it's safe product coming to the public, and basically think of the bureaus doing everything else. I put on here also is that California has created a cannabis portal. So we'll have that website available to you at the end, but just think of it real quickly. It's literally cannabis.ca.gov. And that will bring you to a main portal where you can get links to all these different agencies with their different fact sheets, their different information, the regulation, the legislation if you want to read it, for some light reading in the evening. So what you have is the state cannabis licensing. So this I really kind of wanted to show you what's going on, and there's probably more. I've just in the new regulation, I saw some different licensing types, so this may not be accurate as of today, but it gets you an idea of what you have is you have a variety of cultivation type licenses. You have outdoor, indoor, mixed light of different sizes. So it's a variety of different ways to have the appropriate license type and different requirements for different type of operators. Just think of it as kind of like, right, big ag versus your local organic farmer. You're gonna have different regulations and requirements to cultivate. Then you have manufacturing, and those are kind of in 2 basic requirements of non-volatile and volatile solvents. So basically how the manufacturing process works. And then you have on the other side is what is happening by the Bureau is licensing, your testing laboratories, your distributors, your retailers, and your micro business. Just FYI, the micro business is kind of a blend, so it's your like local cottage industry that's doing a cultivation and doing a little bit of manufacturing and then doing direct to a retailer. So it's kind of a combo there. So it's basically, the concept is you're doing the cultivation, you're manufacturing, you're distributing it out, and then you'll also hear, I was using the word retailer. You're probably like, what's retailer? Versus the original kind of common industry name was dispensary. So now dispensary is a retailer, to be consistent with other state, like a tobacco retailer or alcohol retailer or any other type of retailer. So that's the common name. You won't hear dispensaries in the legislation, but often local jurisdictions will still call them dispensaries. So they mean the same thing. And then your testing laboratories and micro businesses there. So what are we doing in the unincorporated area of Marin? So on the adult use, in response to the AMA at the state level, we came in with a kind of what you might hear as the emergency ordinance kind of came in and said, okay, we're prohibiting all adult use commercial cannabis activities. Key word right there, commercial cannabis activities, and I'll get more into that, but basically that's any sort of commercial business that is happening, and I'll get into the details of the licensing types too. But basically all of the ones that I just talked about, that cultivation, that retailer, that distributor, those are all commercial cannabis activities. And also, we prohibited the outdoor cannabis cultivation. So it was a way that we really didn't know how to properly regulate that. There's different ideas throughout different jurisdictions of like canopy size or number of plants or heights or fencing and so on. So as of right now, anything related to adult use. And so that gets back to the question of what's happening in January 1st, 2018. Not much. In regards to adult use. In order to be able to purchase it at a retailer, that retailer needs to be authorized by the local jurisdiction and also have a state license. There are a few jurisdictions in the surrounding Bay Area. I'll use Santa Cruz as an example. They were working on regulation to potentially allow their existing medicinal retailers/dispensaries to sell also adult use. But they would also, I don't know the current status of that, I haven't looked it up just because we were so busy last week with our own regulations, but they were looking at that, moving that forward. If they were to pass that, those retailers would require a state license. The state does have something they call a temporary license, but it's still an application, and basically it's only good for 120 days. So it's kind of a streamlined way to get these different commercial businesses to become legal in the eyes of the state while they're applying for their year-long license process. So I'm going to defer that to kind of the question section, so if you have specific questions related to that. But in essence, there won't be any place for adults to purchase the adult use cannabis. So in essence, we don't foresee a lot of activity until local jurisdictions start ramping up and choose to regulate. So Marin County, what are we doing on the medicinal side? What we did in response to the original state MRSA is we created the Medical Cannabis Dispensary Ordinance. And that you might have been hearing about is back in the 2016, we went through a process where we went through an application process for dispensaries in the unincorporated area of Marin. There were no licenses issued. And so through that process, we heard a lot from the community, mostly residents, and also heard from the industry and different changes that were happening at the state level. And what we decided based on input from the community, input from the Board of Supervisors, they said, okay, let's look at what was commonly being called a delivery-only model. Let's see if that then would allow, with the goal with the Board of Supervisors to provide safe access to medicinal cannabis, but also be able to accommodate the concerns of the community. And that's where we, last Tuesday, was the final hearing for McDory. So that is another acronym today, the Medicinal Cannabis Delivery Only Retailer. So what that did is, in essence, repealed the former dispensary ordinance, and the medicinal cannabis delivery only retailer is a type of license that Marin has just been authorized. It's establishing a competitive process for licensing of delivery only retailers. The state has basically their retailer, they say they have an option to be closed to the public. We are requiring it to be close to the public. So in essence, think of it as a retailer, as even you can think of a pharmacy. It's close to the public, and what they have to do is they have to dispense the product via delivery. And I'll get more into the details of who can do that and everything in just a minute. And it would, so we're requiring it to be closed, and then also the commercial business requires a state license. Anything else, so those cultivation, the manufacturing, the distributing, the testing labs are all prohibited. So we took kind of that first step, providing the retail of the medicinal cannabis. But we are allowing the delivery of medicinal cannabis originating from retailers in other jurisdictions. So the concern there was that currently there's a lot of providers to those that are in need of medicinal cannabis in our community. So we wanted to make sure that that access was not completely shut off. So we allow it, so whether it be such as in Fairfax, delivered into the unincorporated area, San Francisco delivered in, that would still be allowed by a licensed retailer. So in the McDory, there's some key things. It's limited to delivery only retailers of 4. We are allowing it in an office, industrial, and commercial zoning, so not in your residential zoning, not in the ag area. We are requiring that 600-foot buffer. The schools, daycare centers, and youth centers is required at state level also to obtain a state license, but we are also, in addition to that, requiring 600 feet from playgrounds, so any sort of local playgrounds, state, park, and so on. And the operating requirements, so these are some just key terms. Obviously, this is a high level, but there's a requirement for track and trace through the distribution chain. So once it's cultivated, everything is tracked and traced. The state has, through the new regulations that were just issued, of talking about the details of that. Everything requires labeling and packaging by a distributor. Except for the plants themselves, but they are tracked and traced and labeled. And delivery records and delivery by a retailer employees only. So a lot of questions that I would always get is, who's going to be doing the delivery? It actually has to be by the licensed retailer's employees. So you're not going to have like these third party that aren't doing age verification and patient verification and very critical in tracking everything. You can't just call at some restaurants and you want to get food delivery and then they have a third party person come and just drop off. So it's very regulated. So that was a key element. Then what we did is, because the state regulations weren't out yet, is we put in some of the key things that we were hearing from the community, such as that a customer that's 18 to 21 requires a medicinal cannabis patient ID card. So that ID card that is issued, administered by Health and Human Services. The key there was being able to, right now with any medicinal, if you are a patient, you have to have an authorization from a physician, but with the requirement of the ID card, they have to go through that additional, more stringent review process to verify that recommendation and so on. If you have questions on that, I'll defer it to Health and Human Services, though. And also delivery, we wanted to spell out, because the state legislation just said it needs to be to an address. We limit it to be a residence or a business of that patient. Operating hours, we limited to 9 to 9, whereas the state was allowing 6 to 10. No advertising on-site or delivery vehicles. So we wanted to make sure, we weren't sure if that was going to be in the new regulations. So basically, besides the business name and an identification for emergency response or things like that, there was no advertising. So you won't see like some communities have the big green, the green cross, or advertising the big billboards and things like that. So no advertising would be allowed. And then also no sales of food. So with basically food from no cannabis ingredients. We wanted to make sure there wasn't any cross-contamination or other issues such as that. So I'm going to go ahead and open it up for questions. Yes.
Did Prop 61 say that customers, it had to be 21 years of age Now, this slide says 18 to 21. When did the 18 get changed to 21 or the 21 to 18?
So the question was in regards to the age. So as of right now, the standards, if you have a doctor's recommendation, you have access to medicinal cannabis. It might be, if you're less than 18, that requirement would be through a caregiver. So let's say if I had a child that had seizures and I wanted to use certain medicinal cannabis, I would require to purchase it and be identified as their caregiver, and then purchase it and provide it to my child if I so desired. That requirement for access is basically anybody 18 years or older can have a physician's recommendation and be able to purchase medicinal cannabis. What we were doing is saying if you're between 18 and 21, we're also going to require that you have the local issued medicinal cannabis patient ID card, because we wanted anyone between 18 and 21, because at 21, you can purchase adult use or medicinal. So we figured after 21, you are full-fledged adult. And so that we just wanted to have the concern of the access to those between 18 and 21. We wanted to be able to tighten that or make sure that they were going through the proper procedures.
So I guess my question, 18 to 21 is medical cannabis, but recreational cannabis, it's got to be 21. Is that right?
21 and older for the adult use, also known as recreational. So 18 is you can purchase it. If you're less than 18, you have a caregiver that would purchase, but they still would the patient would still require a recommendation by a physician. So I saw a couple hands over there. We'll go ahead and have the runner with that.
We do want to make sure that we get into the health aspects, so
Yeah.
not too much on logistics, but access is obviously a big deal.
Just how does this affect the medicinal personal growing? You know, like we had a house next to our school with 4 guys each with personal cards, each could raise 7 plants. So they had an outdoor farm next to my kindergarten. Is that still legal?
So a very good question. It's kind of the medicinal outdoor cultivation is a little gray area that we need to work on clarifying. As of right now, it's not very clear on what we can do in regards to regulation. So we can certainly have a conversation offline, but what we're looking at is it is for the adult use, and most likely going to happen for the medicinal is a limitation of number of growing per residence. So you couldn't have multiple people all with either authorization, a medical card, or adult use growing basically a mini farm. It's limited by residence. So we're looking at that and how to do so right now, outdoor for 21 and older, the adult use is prohibited, and then we're looking at how to regulate the outdoor, just because of this transition, because it has been happening basically allowed through the original Prop 215. So we're looking at that. Okay.
And we'll make sure to provide you contact information if you want to follow up with more detailed questions. And we will have time for more questions and comments later. Ready to move on? Thank you.
All right, let's get into the health aspects. So public health concerns. There's a lot of partial science around this, and we decided to sort of hang our hat on what I think is the single best synthesis of the available evidence, which was a National Academy of Sciences report that came out this year. And they essentially were trying to answer the question that we're all trying to answer, which is what in the world is actually known and what is not yet known, and what is the strength of evidence around different conclusions regarding the potential health effects of cannabis. So they gathered a panel of a couple dozen experts across the nation and the world, and with the goal to summarize the health effects of cannabis use, potential therapeutic uses, and impact on short and long-term health. They considered more than 10,000 abstracts, actually looked at 24,000 articles, and it was a year-long process. And this report, Health Effects of Cannabis and Cannabinoids, is available online, National Academy of Sciences. And we're going to just jump into the results. And then they're all for some other findings that may not have been included in that report, but we're going to lean into that report primarily. So these are the benefits. Again, I said, this is not a yes versus no, good versus bad. It's where are the benefits, where are the harms. So there are benefits of cannabis. One of the challenges of cannabis is that it is, by advocates, is considered a medicine. It has not followed the normal processes by which medicines end up in pharmacies, right? It is not FDA approved. They're not the double, placebo-controlled randomized trials. So a lot of this evidence comes from observational studies of looking at cohorts of people who have been exposed to cannabis and then describing their experience. It's a methodology that we don't like to lean into too much in terms of establishing causality and understanding the true effects of something as a medicine, but that's the best we have right now. And they looked at the evidence and they basically organized it into different categories. So conclusive evidence, substantial evidence, partial evidence, no evidence. And I'm including those things where they actually said there was substantial or conclusive evidence, okay? So there's substantial evidence that cannabis is effective for chronic pain in adults, for chemotherapy-induced nausea and vomiting, for multiple sclerosis, spasticity symptoms, appetite stimulation and wasting diseases like AIDS, and that's Marin is actually FDA approved for that purpose, and reducing epileptic seizures, particularly in children. And there was recently a New England Journal of Medicine, or JAMA, article where they actually studied the effect of cannabis in pediatric seizures and found that it was actually statistically significantly improved. Benefits of legal, and I would say, another sort of obvious that is not even on here, which is the pleasurable sensation people receive from using cannabis. We wouldn't be having this conversation at all if people didn't get high with this medicine, right? Or with this agent, right? So that's another piece of this, which is this is being primarily driven by the fact that people have positive experiences with the use of cannabis in their own lives. And it's not, that's something that I think we need to wrestle with, how we even evaluate that when we're talking about harms versus benefits. The same conversation that we have with regards to alcohol. It's pleasurable for people, for some people. So benefits of legalization, this is sort of social benefits of legalization. The Colorado opioid-related deaths decreased 6% in the 2 years following legalization of recreational cannabis. So many of you know that we're working on the opioid epidemic here in Marin County as well with the RX Safe Marin Coalition. This chronic pain in adult benefit with cannabis, I think, correlates to this first bullet here, which is a reduce in opioid-related deaths. In my own practice as a primary care physician, when I had patients on opioids and I did urine tox screens, I never kicked anyone off of their opioids pain contract if they had positive THC, because there are many people who actually experience some benefit from medical cannabis. So there's a potential benefit there, and we're starting to see evidence that it may actually be saving lives. In Colorado and Washington, post-legalization, there are fewer arrests, obviously, if it's no longer illegal. The violent crime rate decreased, and tax revenues increased. And then importantly, from an equity standpoint, arrest rates for illegal use affect minorities disproportionately, right? So our prisons are filled with people who didn't have the same opportunity, the same legal representation, and the same connection socially to get them off of that charge of carrying marijuana, right? So this actually has a tremendous social relief in terms of achieving some of the equity, especially with regards to incarceration rates that are racially biased. Yep.
The violent crime's gone down across the country. Are they saying it's connected to marijuana?
So Don's pointing out that the violent crime rates have decreased as a secular trend across the nation over time. And I don't know whether or not they're attributing this to, I think these are observational studies, so that's a good question, right? Whether the fewer arrests are specifically attributable to this or the violent crime rate. So cannabis-related harms, these are the things we're going to address. Marijuana use during pregnancy and breastfeeding. I think for first 5, this is particularly important. Neurological and mental health effects, effects on youth and young adults, drug interactions, injuries, poisonings, and respiratory effects in lung cancer. Underage use and cannabis. So this is some data for Marin County. For alcohol, Binge drinking in Marin County. This is the Chicks data, the latest Chicks data, 2015, 2016. This is a telephone survey of Marin County youth, 7th, 9th, and 11th grade. And binge drinking in Marin, which is 5 drinks or more, increased from 9% for freshmen to 24% in juniors. We see a rapid increase in binge drinking. In Marin County, 16% of freshmen report smoking marijuana in the past 30 days, 30% of juniors in the past 30 days. And 30% of freshmen and 45% of juniors believed that there was slight to no harm in smoking marijuana once or twice a week. So 1/3 and almost one half of our high school juniors believe that there's little to no harm in smoking marijuana on a monthly basis. So this gets back to that comparison I made to sort of the Southeast and norms about diet. What is the culture? How do we understand what's healthy and what's not? How do we change culture when culture needs to change if we're actually doing things that are unhealthy in normative ways as a county? I think we'll find from this evidence that that's probably not an accurate. If people believe that there is no harm in smoking on a monthly basis, that's misinformed, right? And we can change that. So these are current substance use among 11th graders in Marin County. 40% of our 11th graders have at least had one alcohol drink in the last 30 days. 30% have smoked marijuana at least in the last 30 days, and 24% have binge drinked, which is 5 or more drinks in a row. Cigarette smoking, prescription pain medicines, and inhalants on down. So, is that surprising to anyone? Are those numbers understood? Is that higher, lower than we thought? Right, I think we know we have an issue with this here in Marin County. First full drink of alcohol, so when do people start? Only 4% say they've had it 10 years or younger, but as 11 and 12-year-olds, 13 and 14-year-olds, the majority start at 15 and 16, because these are all juniors who are surveyed, so the oldest people represented within this. And the first use of marijuana, interestingly, 13% started marijuana use between 13 and 14 years old. What's important about this is that the earlier it begins, the more likely it is to lead to lifelong dependency. So the earlier people start using substances, the more likely it is to lead to lifelong dependency. And so trying to get into middle schools and high schools is important. Marijuana is easy to access. 80% of our 11th graders in Marin County say marijuana is easy to access. And 80% of our 11th graders say alcohol is also easy to access. Marijuana is perceived to be even slightly easier to access than alcohol. These are parents. So parents in Marin County are a little more concerned about alcohol use than marijuana use for their kids. So this is the parent norm survey in 2016. How concerned would you be if your child consumed 4 or more alcoholic beverages in a row within a couple hours in the last 30 days? So 88% of our parents said we'd be extremely concerned, right? Only 66 of our parents said they would be extremely concerned if that was marijuana use. So there is a higher sort of cultural tolerance of marijuana use than over alcohol use here in Marin. So I'm going to get into some of the conclusions of the National Academy of Sciences report. So psychosocial consequences. There is substantial evidence that recent cannabis use impairs the performance in cognitive domains of learning, memory, and attention. This may not be surprising because it's part of the explicit effect of these is to affect the neurotransmitters. A limited number of studies suggest that for some individuals, these impairments can persist after stopping cannabis use. So obviously during the acute phase, you're having trouble with memory, attention, cognition, etc. But what's concerning is that for some children, after stopping using, some of those effects persist. And then they concluded that cannabis use during adolescence is related to impairments in academic achievement, employment, income, and social relationships. Health impacts of cannabis for brain development. The teen brain responds differently to cannabis than the adult brain, and regular use among youth can cause long-term damage to developing structures. This is one of the most important factors, I think, for this conversation in Marin County, which is a firewall between our understanding of cannabis use in adults and our understanding of cannabis use in children. And that's based on science and the fact that the adolescent brain, young brains are still developing. And when they're exposed to chemicals during development, it is actually teaching the brain what it needs to do, right? The architecture of the brain is actually still being crafted and sculpted during that developmental stage. And so exposure to chemicals or even toxic experiences, right, the adverse childhood experiences, we need to make sure that those young brains are in safe, secure environments in every way. What they're exposed to in terms of traumatic experiences or chemicals actually has lifelong consequences in ways we're just still learning about. And that's my single most important concern as public health officer in Marin County, is the effect of cannabis legalization on young minds. And I know that's preaching to the choir here with First Five, but if we have one organizer for our work together, is making sure that the policies we develop as a county are protecting our young people against unintentional and unwanted exposure to cannabis. THC causes acute psychotic symptoms in dose-dependent manner and worsens outcomes in patients with psychosis who don't stop using. What is psychosis? Psychosis is an uncoupling of the perception of reality and reality. So for developing brains, this changed brains' pathways permanently. One of the Oh, I lost that slide. Okay, so yeah, so there's evidence that when you take cannabis, we know that there's the bad high, the paranoia that comes in. That's a known effect of cannabis intoxication. What's happening there is that the reality that is surrounding us, the objective reality, the perception of that reality is impaired. So you might have hallucinations and delusions. That's the definition of hallucinations and delusions, that you're experiencing something that is not objectively part of reality. That is psychosis. That happens temporarily in a state of marijuana intoxication. The problem in a developing brain is that is a pathway that can be established that may not go away after the cannabis use has stopped, which is why there's a positive association between a history of cannabis use and psychosis. The Institute of Medicine, the Academy of Sciences report concludes that there is a positive association between cannabis use among young people and early onset of psychosis and psychotic mental illness, including schizophrenia. And that is I think an important concern that we need to wrestle with as a community, and something that as I looked into the research myself, I gained a greater and greater understanding of and more concern around. And I've spoken with some of the psychiatrists about this, and they're seeing this also in the emergency rooms. This was a recent study, again, just adding to the body of evidence pointing to a link between schizophrenia and the use of cannabis. So cannabis use during pregnancy and postpartum. This is so Colorado, thank goodness, Colorado and Washington have done this social experiment before we did, and they've actually been able to measure what's happening. And we've leaned into the evidence that they're seeing, and we will develop our own tools for surveillance of our own experience here in California. But what they found, based on their own research and their own experience, and they did the similar process where they're stratifying the level of evidence, is that there's moderate evidence for decreased growth. So maternal marijuana exposure during pregnancy and breastfeeding, decreased growth, decreased IQ scores in young children, decreased cognitive function and attention issues. Then limited evidence. So limited evidence doesn't mean that there's no evidence. What it means is that there are not a lot of studies that are showing that. That's the limited. For stillbirth, SIDS, depressive symptoms, delinquent behavior, some heart defects, and academic ability. And these are following people prospectively over time. And then they don't have enough evidence around psychosis for the children that have been exposed. And then mixed evidence regarding preterm delivery, et cetera. The National Academy report basically concluded there's substantial evidence for lower birth weight of the offspring with maternal cannabis use. So there's, taking all of that and saying, well, there's one thing we can say for sure, which is that maternal cannabis use contributes to low birth weight babies, which is a sign that there's something, that there's an effect. So, no safe amount of marijuana use during pregnancy. THC can pass from the mother to unborn child through the placenta. The unborn child is exposed to THC used by the mother. And then there's, associated with negative effects, including decreased academic ability, cognitive function, and attention. And we want to make sure that people understand that it can actually pass through the breast milk. Quickly into other cannabis-related harms, poisonings, increased rate of admissions in ED. For this is basically both Colorado and Washington saw increased rates of young kids coming in who had been accidentally intoxicated by consuming edibles that might have been around the house. Symptoms and signs, drowsiness. So these are signs of intoxication of a child. Drowsiness, dizziness, seizure. It might induce a seizure, coma, agitation, euphoria, erratic breathing or heartbeat, and dilated pupils. This is injury and death. So this, again, National Academy of Sciences summarizes that by saying that cannabis use prior to driving increases the risk of being involved in a motor vehicle accident. So just an important single fact, which is that we've talked a lot about, there's been a lot of concerns about what is a DUI with regards to cannabis? How are we going to know? How are we going to test? We have our policies and protocols are relatively developed around alcohol and now some of the other prescription drugs that we can test for. When it comes to legalization of cannabis, we still don't really know how we're going to handle this. But there's clear evidence that we need a solution because cannabis does impair, the THC compound in the cerebellum actually does impair balance and coordination, like physiologically. You need that to drive safely, and there's evidence that there's increased risk of car accidents. And then, again, they concluded that where cannabis is legal, increased risk of unintentional overdose injuries among children. Here's the impaired driving. This just shows the stats that show the number of car accidents that have increased in states where cannabis has been legalized. Some unknowns, some of the questions for us regarding driver safety. How many hours after using pot is it okay to drive? Like what is the, so if you consume a brownie, how long do I need to wait? What is the relationship between THC levels and driving? If we start testing, what is the level? With alcohol, we have a level, a specific level where it's no longer legal. And then persons taking medical marijuana. Do we say, well, if you're taking medical marijuana constitutively around the clock, does that mean you can't drive? Some of the important unanswered questions. Pesticides and other related harms. So obviously, there's a tremendous drive to cultivate marijuana in efficient ways like any other, agricultural industry. And, weeds and other insects affect that. So there's pesticides being used when they're growing cannabis, and especially when it's not standardized. We want to make sure people are not exposed to pesticides. Prop 65 says businesses are required to inform consumers if a product contains any known carcinogens. There are, the fungicides and herbicides also already found in edibles and other cannabis products, and particularly concerning is that smoking a weed that has been grown with pesticides on it is a very efficient way to get that carcinogen that may be on there directly into your system. Other cannabis-related harms, secondhand smoke. So depending on, hot boxing, I remember back in high school, the big bag, people would just like go in and smoke one and see if both people could get high because you're like basically taking advantage of the secondhand smoke. The problem with that is that there's other harms associated with, for people who may not want to be exposed to the marijuana. With vaping, if you see people, the amount of vapor that comes off a vape cigarette, and if anyone is nearby, there can be THC in vape. So you can actually have secondhand consequences of this, just like with tobacco. And what's important about that also is that we know that exposure to marijuana smoke actually has similar effects to tobacco smoke in terms of long-term exposure can lead to worse respiratory symptoms. You'll hear that, and there is evidence for this, that short-term exposure, like you can actually, one of the things that THC will do, or the cannabis product will do, is actually open the airways short-term. So sometimes people talk about how marijuana can help with asthma. That's true, but it also contributes to respiratory harm over the long term because you're ingesting smoke into your system like a cigarette. So emphysema, chronic obstructive pulmonary disease, risk of those things actually increases with marijuana use over time.
You're gonna have vape, like combustibles for possibly cause cancer. If you smoke this, are they gonna have that on the marijuana label?
The question of, so Fred's question is, are they going to label it the way they label cigarettes? And the answer is, I don't know. I mean, I think this is part of the, you know, the question before us is, what do we require? What do we demand as consumers that goes into this? And the labeling, I think we want to make sure that the labeling is the appropriate labeling. And the rules around that haven't been finalized yet. Yep.
Do you know the carcinogens and whatnot, are those delivered regardless of the way that it's consumed?
So the question is, are the carcinogens delivered regardless? No, I think the mode of ingestion correlates to the cancer-causing properties, right? So things that if you're concerned about lung cancer, ingesting it would not cause that, right? Because some of those carcinogens are actually based on the cellular damage that's caused at the level where of the mucosa of the lungs, where you're damaging, and the DNA repair and all that. And vaporizing, yeah, I mean, I think now we're into sort of conjecture, but vaporizing is probably less harmful than smoke with regards to that question. Yeah. Yeah, I think there's evidence that vaping, I mean, for all the problems of vaping, one of the benefits over smoking is that it doesn't have some of that same clear carcinogenic impact of smoke itself. Oh, yeah. So pets, poisonings. So this is happening. Pets are being poisoned. Animals don't metabolize THC the way humans do and can be poisoned by THC, and they're often in, like the edibles are often things pets would like to get their hands on because they look like chocolate or gummy bears or whatever. And some of the synthetic sugars that go along with some of the edibles are actually actively toxic to pets, like xylitol. So this is what people should do if their animals get poisoned. Call the Animal Poison Control Center. I didn't even know there was a separate Animal Poison Control Center. Is marijuana addictive? So I'm going to end with this. I mean, it's still a question, right? Is marijuana addictive? People ask that question. It's interesting to me that remains a question when the majority of our young people who are seeking treatment for addiction are doing it as a result of marijuana, right? So for children aged, or people aged 12 to 25 in Marin County, the majority of clients are actually reporting marijuana as their drug of choice, which is to say that is the reason that they are seeking treatment for addiction. And that's true across the world. If you look at, the younger people are more likely to be seeking treatment for marijuana addiction than opioids and other alcohol. As we get older, those addiction that shifts more towards alcohol and opioids and other cocaine, methamphetamine, that kind of stuff, sort of older. But for young people, it tends to be more leaning towards marijuana. And then this is the number of clients reporting. The other was proportion. This is the actual number. So the question is, what is the receptor that marijuana affects? There are cannabinoid receptors in the central nervous system that are specific. So we actually all make cannabinoids. There's endogenous, like your body will make cannabinoids. That's the reason that system exists. Like we have a way. It's associated with memory. It's associated with cognition. It's associated with pleasure. These are euphoric cannabinoids. And you're playing with that system. When you take in endogenous outside cannabinoids, you're like overwhelming that system. And what it does is it actually increases dopamine levels, which is why it leads to addiction. Because when you ever have that surge of dopamine, which is the reward system, your body starts adapting to that and you start craving that agent. The number of top drug choices for young people at admission for treatment in Marin County: marijuana, heroin, and alcohol. Just to say again, marijuana is high on the list. So more research is needed. We need to know more about studies using higher potency cannabis products. The studies actually are not keeping, the protocols for the studies are not keeping up with the strength of the agents that are in the community. So when we study these things, the strength that we're studying is actually lower than the strength that people are getting, because they're trying to control the research process. So you say, okay, this is the level that we're going to be researching. Well, lo and behold, 2-3 years later, the amount that people are actually ingesting far exceeds the level that we studied. So you'd have to make the logical inference that whatever harm you're seeing at the level that was studied may be increased in the level that people are actually currently getting. Studies of how cannabis affects the mind and the body, and vaping. We don't know a lot about how, some of the questions that have come up today in terms of what's the difference between vaping versus smoking marijuana. How does cannabis affect pregnant and breastfeeding women, newborns, and fertility? We know that it's low, clear evidence at low birth weight. There's mixed evidence around some of the other potential concerns there. And then driving and coordination, as I mentioned. Yep.
Are you, it seems like maybe it would be answered on the next slide. I was going to say, are you just looking at studies from the United States and the United States government? Because there's a lot of studies that have been done over the years that have gotten really good information, given really good information from other countries, because they haven't been as tapped down as our country.
That's right. So you make the observation that the U.S., because it's a DEA Schedule 1, we haven't been able to do good studies in the U.S., but that's not true elsewhere. So many of the studies that contribute to the National Academy of Sciences conclusions are performed outside of the United States, including Scandinavia has done major studies, and the best study I think around the risk of psychosis and schizophrenia is actually a Swedish study where they looked at 50,000 people prospectively over time and saw a very clear association or odds ratio of 2.4 times greater risk of psychosis for people that had significant exposure during their teenage years in Sweden. So we do look at those studies as well. World Health Organization has a great, also 2017 report that basically mirrors the National Academy of Sciences report and its conclusions. These are some of the references. I won't go through them, but they're on here. Questions? So we can take, why don't we go actually to what can be done about pot locally? Just to sort of talk about the environmental, so what can we do as a community now in terms of the environmental controls to protect our young people? And then we'll open up to questions. So I'm going to hand it over to Melissa Struzo, who is our champion for substance use prevention here in Marin County. And Melissa's going to talk about local steps we can take.
Great, thank you so much. So this is just a kind of some samples. We went to a recent training around this, and they had presented some of this past messaging, and I thought it was really important to see, kind of the over time how what messaging around marijuana has evolved. And there's all these terms, you heard a lot today, but this is just kind of an idea of there's so many different ways that we're talking about marijuana in general, and these are kind of the ones that stand out most, are the ones that were kind of pronounced. But here's that future messaging. The future is here, truly. Actually, that is a real billboard out of Alameda County. Up there it says, marijuana has arrived, and that is actually true. As you can see, these are real products that are currently being sold in different retailers or dispensaries. So these products exist. They're there. And this idea of medical wine, we don't necessarily make that assumption, but I just kind of wanted to throw that in there, a little comic relief for all of us this morning. But what I did want to bring to your attention, which is great, the California Department of Public Health has really started their own work and formed a team to develop fact sheets, which you have copies on, hopefully in your packet that you got. You got some of the fact sheets that they're producing. And I sit on a statewide group, a marijuana committee, and we're talking about things like this, and we're bringing this up, all the different prevention coordinators throughout the counties of California, and we're looking to really develop these materials and make sure they're available to each of our counties. So this is good news, and we're learning from some of the different other regulatory bodies that are happening at the state level, and along with the California Department of Public Health, and this website, which I'll have a list of resources at the end you can take a look at. But along with the California Department of Public Health putting together this Let's Talk Cannabis website, the DMV has come together to start talking about the impaired driving issue. The State Office of Education is also coming together talking about the issues around education and cannabis use. So, get through this. Yeah, so it's just a public information education campaign, and there's a lot of information there for you, and they're constantly developing that, so there are going to be more things available for you down the line. So there are two phases. The first phase, those fact sheets really was they're focusing on, and then the next phase are really going to look at more kind of targeted messaging for additional vulnerable populations and continue to gather from all these research studies that are out there. So what are the next steps? So a lot of different things happening. You've heard a lot today already, but we know in other counties too, a lot of the health departments have actually compiled and tracked data with their own epi teams. They've been putting together as a whole cannabis team in Alameda County that is focused on tracking their own local data. And in some counties, like Sonoma County, I'm from Sonoma County originally, and they're looking at managing edible safeties and the safe disposal of product and the byproducts. And so, and all the counties and health departments are really focusing also on prevention and education. And local municipalities, as we heard from Inge, that there's a lot happening around regulating and banning commercial cultivation and access and the delivery services. So it just depends on the county and what they're planning to do. Schools, so this is some recommendations come out. Other counties actually have done this. They send letters home to the parents, really letting them know that nothing has really changed. It's still a drug-free school. There's no new, even with legalization, doesn't mean that all of a sudden, you can just bring pot on campus. So the hope is that that's clear, and if there's any confusion about that, maybe we send a letter home to our parents. And, again, providing training to the school personnel. I heard some nurses were here, so it's important that they understand what's going on and what this might mean, maybe looking for signs and symptoms of poisoning, whether on the edibles especially. So that is something to consider, is doing some trainings with the schools. And with parents, there's some things that can be done, and there's actually some also fact sheets information that the state is putting out around how do you talk to your parents around using cannabis. So, and there's also Drug Free Kids and other websites you can tap into that has a lot of information around that. Oh, big one. So part of my work here in the county, which is really exciting, is that I help to facilitate this Marin Prevention Network, the MPN, which is really exciting. And it has a lot of different groups. There's a lot of regional coalitions that have come together, and we have this joint coalition. And we sit and we talk a lot about substance use prevention in different areas. And as a group as well, we've come up with different priority areas, and we're trying to develop different campaigns and work with our regions to implement these campaigns. So I see a lot of our coalition members in the audience, and that's exciting. And so this is one way you can get involved. If you want, as a concerned parent, a community member, you can actually come join and be part of these coalitions. Tons of resources I mentioned before. You've got the California State resources. You have Marin County. We have some resources available as well. There's a website that Inge's department, the marincounty.org cannabis program. That's where you can get some information about the regulations that are happening in the county. And then Marin Prevention Network has its own website as well. And there's some information about how to get involved and be active around this issue. Health and Human Services has a community health and prevention site that's being actually updated right around this time, so you'll have a lot of new information and be able to access that as well. And I actually put Sonoma County's website up here. It's a really comprehensive website as well, and there's some great information about all these different categories, and it points to a lot of other websites throughout the state of California. So I wanted to play a game with you. I've played this with our coalition members, and I thought it would be a lot of fun, and we can have a little end on this kind of more part here. So the idea of this game is that I'm going to show you some pictures, and you're just going to call out what you think where the pot is in the different products. So we're starting with the butane honey oil. There's some questions about what that is. So out of these 4 pictures, which one do you think contains cannabis or pot? Just yell it out. I hear D, a lot of D's and B's. Okay. It was B. Do they look different? Not really, so it's hard to tell. How about butter? Some people didn't know what butter was. Out of these 4 pictures, which ones contain pot? B. That is pretty easy because it's pretty green, so that probably was the easy one to figure out. All right, how about the butter cookies? So these are the cookies that are made with that butter product. Which one here contains pot? A, I hear A. C. Looks the same, right? Okay, let's go on to the next one. This is the Gummy Bears. These are gummy candies. There are two actually in this particular slide. Which of these contain pot? Which two? C, I hear C for sure. And D, I hear C and D. B and C. And what I'm particularly surprised about B, I thought B was quite nice. The colors were very, I was going for D for sure, but it's B and C. Okay, so moving on. How about Kale Chips? I thought it was really poignant for Marin County. I chose the Kale Chips, and these are all real products, by the way. These are real products. Out of these, which one contains pot? B, C, I hear a lot. It's A. Okay, moving on. Okay, here are two more. These are drinks that are infused with pot. Which ones contain pot? I hear A, I heard a B, A and B. A for sure, and B. Yeah, you got that. They had some very distinct, if you look closely, there's actually a pot leaf on one of them, so. But, okay, how about vape juice? Do you all know what vape juice is? So this is part of that. When they're vaping, they actually put this liquid inside the vaping. Which one contains pot? Do we know? C. Okay. So that's those. I didn't. There's more. There's brownies and cookies, cupcakes, candies, truffles, whatever you want. You can find it. So, but what I really wanted to show is just knowing these basics. And so there's concerns. We know that packaging is going to be different here because of the new state laws and regulations that are happening, and we'll be mirroring some of that state regulation. But what's important to know is that these products are still available in other parts like Oregon, so it's going to be hard to regulate if these come down, if someone drives it through. They're not technically allowed to, but they might show up here in California. So something to think about.
Also, once the product is out of the package,
Right.
a parent, a teacher is not going to know the difference.
Exactly, especially a young child. They're going to see that Pop-Tart. I actually kind of like the Pop-Tart better. Look, it's got a frosting option on top. I mean, if I was a young child, I think I'd be more enticed by that frosting version. So you've got Pop-Tart versus Pop-Tart. And if you look really close, Captain Chronic, I mean, these are actually really aimed at kind of advertising towards our youth. They're really, the colors, the designs and everything. But yes, once they're out of the packaging, they can't tell the difference. And we saw with like the gummy candies, they actually looked higher quality better than some of the other real candies without pot. So that was my section, but we're going to join our questions. I know we already answered the questions. Yeah, I'm going to take it out. And also, if any more additional, okay, got it.
Questions or comments?
I have a question. I don't think that the police yet, correct me if I'm wrong, have a way to tell if you are, under the influence of marijuana, like they tell if you are under the influence of alcohol. So how do they bust you or not? But how does that work? How's that going to work?
So there's something called a DRE, and it's a special trained officer, and they're actually trained to recognize drug symptoms. So they, your CHP have been trained, some of them. So, smell, the pupils, they're looking at all these different symptoms that might, actually be a sign of the person being intoxicated. The way they're acting, a lot of different things that they're trained on. It's not like they have a field test like alcohol, right? They don't have breathalyzers, but they are actually working on that. I know Colorado's. Right, the physical symptoms. But the hard part, the reason why they're looking for cognition impairment and different kinds of impairment. They're looking for that. The way that they have specific questions that they're being told to ask them. There's things that they can do to help detect. And if they do suspect, they have probable cause, then they can take them down and deal with it. Especially if they've been involved in an accident. They will take them into, as far as I know. Do you want to speak to it at all, Bruce? Maybe our DEA agent can help. Do you know about the DREs and?
Well, I don't know the specific training the CHP is going through right now, but there are some recognizable differences between being under the influence of alcohol and being under the influence of something else, either marijuana or some type of narcotic. So there are some subtle differences. I'm not schooled in the specific forms of training for that. It's kind of out of the pure view of what I did, but there are differences.
What I mean is, they give you a breathalyzer test and they can tell for sure if you're, over the limit. But what do they do, what do they have that's going to kind of equal that for marijuana is what I'm asking, I guess. I'm done. I know they are,
Right.
but but what happens until then?
Eye movement test now is what they rely on.
I'm sorry?
It's an eye movement test they rely on now.
And then what, they take your blood later? Is that what they do? But I mean, so how can they, but that's all subjective. It seems like there
They
needs.
stick their head in the car, it reads like marijuana.
But if you smoked it before, it just seems like.
I think the point is like that testing. The testing piece is kind of under development. I think those are unanswered questions. Like the .08 for alcohol is very clear. We all know that. But I think for cannabis, I think that's being discussed and developed, and yeah.
Yeah, those
so.
are the unanswered questions we had up earlier. Specifically, it's really unclear.
Yeah.
That's what needs to be discussed and figured out.
Right, but
You're
that's
right.
what I mean. So how, I just don't understand how they can arrest you for it or whatever if there's no definitive, you are. That's all.
Right, right.
Thanks, Kathy.
Yeah, good questions.
Hi, Melissa. I'm an OBGYN practicing here in the county, and I love all these resources. I'm going to give them to my partners who couldn't be here today. But I also have a teenager, so I'm interested in your initiatives entering the local high schools with this information. I know we have Be the Influence at our high school, but do we have point people going into the schools to kind of lecture them with this? I know it's not new data, but
Yeah.
to refresh them on this?
Good question. So there's actually a group called Being Adept, and they are, right now, they're going into middle schools primarily. So I know that they go about 15 different schools they are going into, and they do have a curriculum specifically, and 1 week of curriculum or one particular lesson is focused on cannabis, and they have another lessons focused on just smoking in general, including vaping and including smoking marijuana. So they are speaking to the middle school group, especially. We're learning a lot how important it is to start younger. As you saw, 13% of our teens at 13 to 14 years old are starting using pot, so we want to start talking to them sooner. So that is happening. We don't have specifically a student assistance program, but there is a lot of work that the different coalitions are doing and bringing that information to their different schools. Adept, yes. Yes.
Yeah, the Marin County Youth Court. The Marin County Youth Court does educationals in the middle schools and in the grade schools. And right now, we're particularly focusing it around the marijuana industry, is after your developing brain, and we're looking at it from the industry taking financial advantage of the children. And that's a very easy way to have that discussion without coming up against the youthful perceptions of it.
Linda, do you want to say something about the coalition?
The coalition I work with works with the Drake School District and the Redwood School District, and we partner with the schools, the wellness centers, parents. We're doing a parent education event that Matt and Dawn will both be at next Tuesday night, November 28th, from 6:30 to 8 at Drake High School. It's going to be similar, but a little more focused to parents and youth and the impact. So we do a lot of parent education. We do a lot of communication through the principals that goes out to the parents. There is some education to students in school. I know at Redwood it's in 9th grade. They have social issues, and Drake does it every other year. But in my opinion, we need to do a lot more. And there's flyers about this event on the table on the way out.
And we're learning that we got to get into the middle schools. The earlier the better.
And two other things too is we do the Marin Prevention Network, and that's a big part of the work we're doing. We actually are talking a lot about cannabis there and finding ways that we can get into the school, developing information and getting that out. And the other one I want to mention is Friday Night Live and Club Live. Some schools, both at the middle school level and high school level, have groups of students who come together, and cannabis is one of the issues they're discussing as well and learning about it in that more formalized environment. So.
My question is for the doctor. I have a case like this. There is an adult at home smoking medical marijuana. There is a 4-month-old baby living in the house. Can this baby be affected by the smoking?
So I think there's evidence that secondhand, depends on the level of vigilance, right? Obviously, but it's similar to cigarette smoking. We know from cigarette smoking, when smoke is put into the environment of the home, everyone is affected. So the short answer is yes, it's possible, but not knowing specifically how well she isolates herself when she's actually using, I don't know whether or not this particular case is a danger.
Hey, Matt. Just want to do a little info share. So the Alcohol and Other Drugs Advisory Board for the Marin County Board of Supervisors has been studying this and looking at this pretty seriously too throughout the county. There's a couple information points that you could look at if you wish to research it further. Rocky Mountain HIDA, HIDTA, has incredible reports out for what's happening in Colorado. And then SAM, Smart Approaches to Marijuana, and they look at much more in the national view of other states and what's been going on. The one thing we haven't mentioned, unfortunately, is that a lot of the marijuana industry says nobody dies from smoking a joint. Unfortunately, what you do get is two things. One is a number of people who do track all the way to heroin usage and high drug usage. If you ask them where they start with the first joint. So that's a reality of the game, unfortunately. Another thing is the suicidality. And this is something that if an individual, usually in their late teens, early 20s, commits suicide and they do a tox check on the individual and all they find is high levels of THC, that's something to just kind of put on the radar screen too. If I didn't mention it, it wouldn't be correct. So thank you.
There are a lot of areas like that where the suicidality, I mean, where there's controversy. What we've highlighted today are things where there's actually that controversy has been navigated by panels of experts and hundreds of studies where we know, what I'm trying to communicate to this audience is what do we know thus far? And I would argue that it's sufficient to be concerned, right? That we want to make sure that we're protecting young people because we know there's an association with psychosis, we know there's an association with cognitive impairment, et cetera.
Hi, I had a question about cannabinoid hyperemesis syndrome. I read in Colorado that they had a lot of emergency visits because a lot of people are coming in with the stomach aches and pains, and so I'm wondering, are there any long-term effects associated with that at this point, or have you heard of it?
Cannabinoid hyperemesis syndrome is something we're seeing more and more of in emergency departments. This is almost a paradoxical effect because we know that cannabinoids, there's evidence-based that it actually helps people that have nausea, especially if they're having chemotherapy-induced nausea. But it also actually, for chronic regular use, people will actually develop a hyperemesis syndrome where they're actually having nausea and vomiting, intractable vomiting, and they come into the emergency departments where there's and if you talk to our ED docs, they actually sort of recognize this, demographically, and they'll say this is a guy, otherwise young, healthy person who's just like cannot stop vomiting, and they'll check his THC, like that's the first thing, and they'll find high level of THC, and it's this syndrome that is being more and more seen. One of the concerns around that is actually the treatments for that kind of hyperemesis can be like benzodiazepines. So, some certain sedatives can actually, so you can actually begin that gateway concept that actually can be, the medicine used to treat the side effect of the cannabis can actually lead to a different form of dependency. But generally that goes, so that hyperemesis will go away once they stop smoking. The problem is that it's often the consequence of a sign of dependency, right? It's a consequence of chronic use, and it's hard for people in that state to just stop.
Okay. Other questions?
Hi, I was curious about the breastfeedings, infants of moms who are smoking marijuana or taking it in some way, and just wondering how we're going to support breastfeeding while also giving this important information to moms. Historically, sometimes breastfeeding has been, or moms have been told to stop if they were smoking or taking any kind of medications, and so I'm just hoping that we can have a message that also supports moms who are breastfeeding while still supporting the babies to be healthy.
Do you have so that sounds like a message. You want to just summarize your message? So what is your message?
Well, that is a good message, I guess. Yeah, I think that just with other substances, you have to look at the pros and the cons and the risks and the benefits, because I think although I don't know, because there aren't enough really long-term studies to know all that information, but it does seem that it probably wouldn't be in the best interest of infants to be told to stop breastfeeding. So,
Thanks for being here on behalf of the Marin Breastfeeding Coalition, Susan.
you're welcome.
Other questions?
Hi, I'm wondering, in the study that you cited, the federal study, if there mentioned either risk factors or protective factors for adolescent initiation of cannabis use or abuse by adults that led to either, like, just like alcohol, lost work days, lost productivity, or bad use patterns.
There is a section on risk factors and protective factors in the National Academy's report. The one that I think emerges most importantly with regards to young people is the environment. Sort of gets back to the sort of what is normative. So the norms around them, whether or not it's it's their friends, their community, and most importantly their parents. So a household norm of substance use is one of the most important risk factors for adolescent use of substances. And we know that from alcohol and other substances as well, and that's true for cannabis.
I'm curious about the regulations on delivery and what's recorded on the person it was delivered to. So, and this must already be happening with other counties delivering here to Marin. How do we know that it was delivered to a person who was an adult or had a proper permit, and who checks that, and what are the penalties if a delivery person or company is violating the regulations?
So great question in regards to delivery. First, I'll answer for those that are licensed within, so if it's licensed by unincorporated Marin, we would, well, actually, let me back up to the state level. For an actual retailer, the state has requirements both in the legislation and also within the new regulations that were just released last week, is basically the information that they have to verify when they are actually delivering. So identification, verification of their doctor's recommendation, and that information is also then tracked at the actual retailer facility. Then us as a local regulator would be doing that verification as part of their inspections for their annual license. So I don't know if it would be myself or one of our staff would actually be verifying, one, they're keeping those records and doing spot checks to make sure that they're delivering and keeping all that information. There are additional details in the new regulations, which I'm just reading through in regards to certain requirements too, as I talked about, of where they can deliver to and so on.
Follow up on that. Are you tracking volume, like cures will track volume of opiates?
Yes, so there is, in the new regulations that came out last week, there are maximum limits per day of which a retailer can sell to a patient or a caregiver. So there is tracking of maximum quantities of product, raw or manufactured, and so on. There is listed as per day or per the doctor's recommendation. So there's like a maximum daily, and then there's also, they'll track what the recommendation is. So certain recommendations might be, have allowed certain amounts, so similar to a pharmacy where they're tracking how much they are selling.
I get a lot of young people in the youth court with other people's scripts.
Yeah.
Right on the box.
Yeah. So that is going to be tracked, and yes, and that requirement for all the track and trace. So part of the review of their records, we would be going in and looking to see, we would necessarily have the name of the person, but would be able to track based on the sales. So we're looking at those, how to track it.
So if that ended up as evidence in the police department report, would that get kicked back to you?
I'm not sure. I'm still working with the sheriff's department on exactly how we're going to communicate with that. So I don't have an answer to that yet.
And that relates to another point, which is the surveillance around this locally. So there's so much that we don't have control over in this environment, and there are ways of actually knowing how this is impacting us as a community, and that is through incidents of different kinds of events. So we can actually track emergency room visits for youth who are coming in with psychotic symptoms. And so no matter what we're doing to try and regulate this, we actually have that fail-safe observational experience where we can actually watch and track over time. So we're working with the epidemiology department, and our hospitals have already agreed to sort of offer us incidence data around certain kinds of occurrences that would signal that we're getting more access to young people.
Okay, another question here.
Hi, I was wanting to also just mention a comment to that topic, which is I've heard through youth that Amazon drop boxes are used, like through 7-Eleven, for example, for getting drugs. So I just wanted to throw that out there as one more source to look at in terms of regulation. My question was based on the fact that adult use is high for drinking in our county. Will there be data collection on adult marijuana use so that we can see the correlations? I just wonder if that's something that's on your radar.
Yeah, we don't have great data on adult use of marijuana. It's not one of the survey, like standard survey questions that come from the state. So we'd have to fund our own survey around that, and we'll have to make a decision about whether or not it's a wise investment.
Well, if you want to start with our attendance today, I have everyone's email, so perhaps you'll be getting a survey by email, and it'll be anonymous.
If a little biased.
Is there any budget to do like the enforcement that they do with liquor stores? You know, there's a budget that gives us alcohol. So they deliberately send underage kids in to buy cigarettes or alcohol to sting. And I'm wondering if there's any plans to do that with these delivery services where you have a 14-year-old ordering it and they, I mean, you know, if there's somebody's home, I can't imagine anybody, unless there was that kind of fear, you know, given about how old the person really is, you know.
Right, so
that's the question.
Definitely.
Is there funds to do that?
Yes, at the state level, there's a specific funding at the state level to be able to do those types of spot regulation, I guess, in the sting operations. So the state will be doing that just like they do for alcohol and tobacco. We are working, and that's where I really kind of want to emphasize and kind of add to my responses. Basically, we will be, or I should say, I will be working specifically with the Sheriff's Department and also seeing how are we going to communicate when they are seeing, because everything will be track and traced and supposed to be labeled, it'll also be a very quick response to be able to communicate to know where this product is coming from and how did they acquire it if they illegally acquired it. And then also to the question that was in regards to funding and surveys, part of the actual application guide that I'm developing right now, because the application, so during the next month and a half or so, before we start taking applications, I'll be working with Health and Human Services team to develop what type of information do we want to request them to track. So that way that will support to get data and also whatever they feel is necessary in order to get more information, more surveys or data, we'll be able to start doing that tracking, and we can put that as part of the license application. So within obviously the legal limits of what information we can capture, but we'll try and incorporate that as part of the license requirement.
Question?
Also, just another answer to that. The state has a very, is this on? The state has a very well-funded now surveillance system and staffing at the state level. And they are definitely thinking of adding additional questions to the surveys and the various, just the various ways that they're gathering drug and alcohol data. So they are definitely going to recommend and perhaps fund adding a question to CHIS, for example, for adults. And
Thanks. So obviously, this is valuable information. Obviously, it's on our minds because of the change in laws. My understanding is that kids don't have a hard time finding cannabis now. That's my understanding. And so what we can expect to happen, and I moved here from Colorado a few years ago, what we can expect to happen is an explosion of supply. There's going to be so much supply, especially with not limiting growing plots. Like in some places in Colorado, they limit it to an acre. They wanted to keep out big tobacco and other interests because this is a business, right? This is definitely a business. So there's going to be an explosion of supply. So I'm thinking more, I go back 40 years ago where I read a book by Dr. Andrew Weil, who's a systems thinker on health, who wrote a book called The Natural Mind, and the subtitle was A Revolutionary Approach to the Drug Problem. That was 40 years ago, and I think I read it 30 years ago. And part of it, one is about humans' history in experimenting with altered states. That's one section. But the other is about calling a drug a drug. So I'm interested in, now I understand there's a week or two of education in the school systems. I think this is a much bigger issue. I think that calling a drug has to do with, well, I've had my second cup of coffee, I can start working now. Caffeine's a drug, right? And this is kind of what the book talks about. Kids drinking 6 or 8 Red Bulls is not a good thing. So this is about drugs to me, and I want to know if you're aware of health departments or school systems that have really incorporated an evidence-based substance curriculum, which is also science-related and health-related. So the stuff that Dr. Willis puts up on from the Academy of Science, which is not emotional, which is evidence-based, which is science, can actually be taught to kids starting in middle school so they know the difference. So that's my question.
Thanks, Steve. So Stephen is the CEO of the Coastal Health Alliance out in West Marin, where I know is particularly interested in cannabis. I just want to get to point to this. So 45% of juniors believe there are slight to no harm in smoking marijuana once a month, or once or twice a week. So these are similar conversations to what our conversations around opioids are, which basically gets to that question of why are we consuming, and how do we determine what is normal as a community? You're right, access is already abundant. We already know 80% of our juniors say it's easy to access. So if we're going to see change, it's actually going to be in beliefs, knowledge, attitude, beliefs, and understanding. And Melissa has some suggestions on how we're going to address that.
Thanks, Matt. I appreciate that. Well, actually, there are programs. They're called student assistance programs, and they are based. There's a national registry from SAMHSA, and they do have a list of programs that are substance use prevention programs and education programs. And they, again, some schools, counties have adopted those. Sonoma County was in 16 different schools providing that. It's a variety of different methods, from parent talks to one-on-one with children and doing assessment to having groups, clubs, all these different ways to talk about substance use prevention in general. It's all drugs. It's not just cannabis, but you often could tailor it to the community you're working with. So if there is a real issue around binge drinking, then they might emphasize that more in some of the curriculums. There is some flexibility, but there are a lot of different available evidence-based curricula available.
Yeah, the other is low-hanging fruit here is that knowledge, right? So if we can help infuse the dialogue in Marin County with some of the knowledge that we're gaining in terms of the actual harms, I think that's going to be the first step. Yes, there's the evidence-based curricula we can get into the schools, but there's also just the collective understanding. And if we start narrating around this differently and saying, you know what, this is not nothing, right? This is actually, like, when it comes to young brains, cannabis is harmful, period. And if we can own that and believe that and carry that forward, that's going to change the conversation, because that's just based on my own experience with my own friends and the culture that's not the way we're talking about it, right? We know that our parents 66% would be highly concerned, right? 45% of kids would be concerned. So we have a lot of progress to make just in terms of understanding the science of the potential harm.
I think it's important. It's important to point out in environmental prevention, education is the lowest producing determinant of a change. And there are other things we can do that will produce more change. So hanging our hat on education isn't going to cut it. We have to do other things. I think we have to make the penalties meaningful to teens. Suspending a kid for smoking dope at school is a vacation to go home and smoke dope.
And some of those evidence-based programs actually do include an environmental prevention component. In fact, that's a pretty heavy part of it. They require like school policies to be changed, working with parents and community members, and asking people to sit on coalitions working on environmental prevention. So it's a big part. The state does recognize that as a very important way of addressing this issue. So.
Okay, we are at 11:30, but let's get a couple last questions so we can hear from everyone. Go ahead.
Yeah, I had a question regarding exactly what you're talking about with the attitudes and beliefs. It's hard to develop an attitude or a belief for myself that's not based on a bunch of research, as you say that we're lacking research at this time. So I guess going away today, I'm wondering if the message you're hoping to create is that this once class 1 drug is now going to be on the streets alongside tobacco and alcohol and kind of on par with those, or if we're so terrified that this class 1 drug is on the streets that we wish it would be a class 1 drug again. I mean, I'm kind of confused here. Like, I know that we can't go back, but I just feel like it's being a little bit demonized more so than alcohol and tobacco, which I feel are like very, very significant concerns in our youth. And I'm not a huge proponent of marijuana, but I mean, I do see that it has some benefits, and I'm just kind of confused as to what the message here is that we're taking away. Like, are we thinking that we're going to criminalize youth even more that use marijuana versus youth who use alcohol or cigarettes, or like, I mean, I guess I'm kind of confused.
Well, there's no simple answer to that question. I think for me, the take home is we need to do what we can to protect our young people from using cannabis. We have some inherited strategies from alcohol and tobacco because we know that those are also harmful to young people. What I've suggested here, what I'm learning, is that the harms of marijuana use in youth can be more serious than the harms of alcohol use or tobacco use, potentially. Can be. Based on evidence that it increases the risk of psychotic disease, for example. That's not the same. I'm not sure we need to get into a debate about what is the relative difference in the harm of alcohol versus marijuana versus tobacco with regards to use. We know that we want to protect all of them from all of those things, and that our strategy should be designed to explicitly protect them. We're offering some evidence for why we would adopt those strategies, and I think we're borrowing tactics from alcohol and tobacco and trying to apply those to cannabis. And that's creative space right now for us because the legislation is still being written. Town meetings are happening around this where people are standing up and saying, this is what I suggest. And my hope is that those conversations are informed by knowledge and understanding of the harm of exposure in young people.
I think my comment ties well with what you're saying because I was looking at the CHICS data for the perception of harm for the older kids, the juniors, and it's high just like it is in the perception of harm. It's high. They know the information. They know that it's harmful, the same way that it has been for alcohol. For the older kids in high school, they know that it's harmful, but they still use it. And so the lesson from alcohol, at least for our county, is that we were being able to lower those rates very well by doing a multitude of things, not just one thing. And actually, education of the kids was the smallest of it, because the most impactful stuff is what we've been able to do at the policy level with alcohol. And I think that that's where our lesson is, and that's where we should be looking. We have the answer. We did it here in Marin. At least we've done it in some areas of Marin, I should say, that the rates have gone down dramatically, even much higher than the national rates that have been declining. So I think we do have some answers, and we need to focus on that so that we can transfer those to marijuana here.
And if I could throw in one more thing, a couple of years ago, we had Patrick Kennedy come in with the support of Mary Jane Burke, and we held the Marin 420 Marijuana and Youth Conference. And it really was designed to try to get ahead of this because the families that have been impacted by it already is real. It's a reality out in our communities. So I think the big takeaway for me personally and what we've experienced in our family and from the presentation is mental health and wellness in our young minds. And that's really the battleground. I think that our coalitions and so many people in this room who care about our kids and families is to really, that's the area of the highest concern. And so it's just, I can share that all day long. And thank you for this presentation. It's been excellent.
Thank you. And what a tremendous resource we have here in Marin County. I mean, I think one of the reasons we're the healthiest county is that we can have these kinds of conversations. And we actually have right in this room an army of people who can go out and actually implement what they're learning to actually protect our young people. I mean, the stakeholders around this room right now are the people we need to be having this conversation. Maybe we could have a few more educators. It'd be good to have, but this is during school time. But getting our school superintendents and others into the conversation will be important as well. Last.
We have one more question. While she's standing, as the parent of a teen, also as mentioned earlier, I think, as Matt said, acknowledging that there is feelings of euphoria. I mean, acknowledging to the kids, we know it makes you feel good. Like, it's not just telling them that it's bad and letting the education be fair and accurate, but getting the brain information in there and letting them know how and why it's not good for them.
Right, there's a term I saw in one of the reports that said they are unprepared for the euphoria. Right, because it's true. Like, if you talk about it like it's bad, 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 and then they use it and they're like, oh my gosh, that was awesome, right? And that's why people use it again. Yeah, right. So anyway, go ahead.
So I don't have a question. I just wanted to, I don't know how many came as just parents. It seems like there are a lot of educators and county people. So I'm just a parent. I grew up here in Marin County. My parents smoked pot like it was cocktails. There were hot tubs. That's what I came from. So I'm bringing this up because I heard like education isn't the way to go. And maybe I'm stating the obvious, but man, I had no idea about the dangers of pot because, like everyone's been saying, it's different today than it was. But what I heard today has really shifted how I'm going to interact with my son about what's going on. Because, so the point I just want to make is that I think educating parents who grew up in Marin County in particular is so key, because I, with all my son's parents, have kind of came from the same place. Much rather have them stoned on the couch than out drinking alcohol until they pass out and possibly kill themselves. I still have that stance, but at the same time, I didn't know all the damage that was being, or the potential damage. I still don't believe it to be a gateway drug, but I have more information today than I did when I came in. So I just wanted to throw that out there, that keep educating the parents. And a key, I think, would be how to talk to the kids to not shut them down. Because like you said, it's better to be able to talk to them so that they're part of the conversation, not just saying, you cannot do this, because they're out of our control. I mean, my son he's a human being walking the planet without me. Like, I only have so much control. So anyways. So anyways, I just wanted to add that to the conversation.
Thank you so much. And I
Thanks.
just wanted a really quick plug too. We do actually have a speaker coming in April, confirmed, thank goodness. And his whole spiel is no scare tactics, and he works with young folks. His name is Matt Bellis. He's a neuropsychologist, and is about substance use prevention. And he really takes it from a comedic approach to it, but very seriously, but in a comedic way. And so, but he says scare tactics don't work, and he really talks about that. And his whole point is a natural high versus chemical high, like how to replace it, because the youth are looking for alternatives. Then, if you get that great euphoria, what can I do instead to get that same level of euphoria? So that's what his whole talk is about. That. So he's coming in April, and we're hopefully working with Marin County Office of Education and have that for parents and for the students.
Can you repeat his last name in case someone wants to look him up?
Sure, Matt Bellis, Bellace.
Great. Okay, I think we're good. Thanks everyone for a great discussion. Just a couple, great. Thanks to Inga and Melissa and Matt. Lots of good information today. A couple housekeeping things. Please, if you have a moment, fill out the survey at the back of your packet. That's what allows us to keep bringing these sessions to you at no cost. Also, the handouts were from the CDPH, California Department of Public Health website, Let's Talk Cannabis. I just printed a few of them, the ones related to breastfeeding mothers, pregnant women, children, but there are other other fact sheets there that are great for handouts about legal use by adults and other issues that are good resources for you. You have a list of resources. There are quite a few there. Also, today's session is being filmed, and we will have that available to share and use. It will be on a YouTube channel. I will try to send that out probably over the holiday, probably in about 2 weeks. If you don't hear, you're welcome to check back with me. More next time. Oh, last thing, just for Marin Communications Forum, 2 weeks from today, December 4th, our next session is called Making Ends Meet in Marin, and we're going to be talking about unaffordable housing and unaffordable childcare, part of which is an ongoing discussion in Marin, but we're really looking at it from family budget and the impact of working families in Marin. We have it's an economic presentation, so Cynthia Murray is going to be here from North Bay Leadership Council, and Rob Eiler and Robin Sternberg from the Marin Economic Forum. Plus we have a printed handout for takeaway, and I think it'll be very informative. Thank you all for coming today. See you next time.